All right, well, good morning, and thank you for joining us for our latest media briefing on important healthcare issues in the news. I'm Dr. Adam Kassam, president of the Ontario Medical Association, which represents more than 43,000 doctors right across the province. Now, this is an important week for healthcare in Ontario. The province will be releasing its budget on Thursday, the last one before the June 2nd provincial election. And this is the time for government to lay out how it plans to deal with the backlog of care created during this last 2 years of the pandemic, those 21 million delayed surgeries and procedures, x-rays and other diagnostic tests, treatments, and checkups. It's also the time for the government to explain how it plans to fix the cracks in the healthcare system that existed before COVID-19, but grew during the pandemic. We all know that you can't have a healthy economy without a strong healthcare system. That's why Ontario's doctors are calling on the provincial government to take steps in this week's budget to reverse the chronic underfunding of healthcare in this province. But we know that Ontario can't fund its healthcare system alone. And that's why we're also urging the province to put even more pressure on the federal government to contribute its fair share. The Ontario Medical Association strongly supports calls by Canada's premiers for the federal government to increase the Canada Health Transfer to 35% of provincial and territorial healthcare spending, up from the current 22%. And that would give Ontario $10 billion a year and put us back on course to being a national leader in healthcare. And Ontario has fallen so far behind in healthcare spending over the last 30 years that it now spends less per capita than any other province or territory in the entire country. And these are results of decisions by provincial governments of all political stripes. There was a decrease in per capita spending in the 1990s, flat spending between 2012 and 2016, and spending below the minimum required to keep pace with demand in other years. Just to get to the middle of the pack, to reach the national average, Ontario needs to invest an additional $5 billion a year every year. And increasing the Canada Health Transfer would cover this. Healthcare spending was originally supposed to be shared equally by the federal government and the provinces and territories. But Ottawa's share has actually decreased over time. Today, the Canada Health Transfer funds only an average of 22% of total provincial healthcare costs. Ontario has lost billions of dollars that could be used to provide better healthcare for all of its residents. And the OMA has a roadmap for better healthcare with 87 specific recommendations. Prescription for Ontario Doctors' 5-point plan for better healthcare. Taken together, the recommendations in Prescription for Ontario offer a comprehensive, integrated solution to ensure that current and new healthcare dollars are effectively spent, address the current and new demands that will be placed on the system, and improve care for all Ontarians. Now, those new challenges include clearing the backlog of 21 million healthcare services built up over the course of the COVID-19 pandemic that will take months and in some cases years to clear, the looming mental health tsunami, and the return of those missing patients who did not seek care during the pandemic and are now showing up sicker and with undiagnosed conditions requiring more aggressive treatment. Now, spending money alone is not how to make Ontario a place where people want to live, work, and invest. The province also needs the health human resources, more doctors, nurses, personal support workers, and other healthcare professionals at a time when many are retiring or leaving the profession because of burnout exacerbated by working on the front lines of the pandemic. Ontario ranks 7th among Canadian provinces in the number of doctors per 100,000 patients and has one of the lowest doctor to population rankings among the OECD nations around the world. And the shortage is especially acute in northern and rural areas. What we are talking about here is that we need a plan for the future. We need a roadmap for the future of healthcare in the province. We're looking forward to hearing what the province has to offer in this budget coming up. And right now, what we're going to do is actually open up our Q&A session, and Ashley Molnar will actually be moderating this portion of today's briefing. So please put your questions in the Q&A chat. If we don't get to your questions due to time, the media team will follow up with you, and you can email media@oma.org with additional requests for interviews. We'll also have a recording of this session available later this afternoon. So with that, Ashley, I'll turn it over to you.
Thank you, Dr. Kassam. The first question for you is, why are you calling on the federal government to increase the Canada Health Transfer now?
So healthcare is a team sport, and I'm going to work later this afternoon in the hospital where I'm going to be working alongside nurses and physiotherapists, occupational therapists, other physicians and other healthcare providers. And so we know that healthcare is a team sport. And when we think about healthcare, when it comes to funding and the administration of healthcare at many levels, we know that both the federal, provincial, and municipal levels have a role to play. We also know that right now we have a big challenge ahead of us, which is getting through the backlog of care, which is one of our key pillars in our 5-point plan for better healthcare here in Ontario. But in order to be able to do that, we need the support of the federal government, which includes Canada Health Transfers to be increased. Now, we know that the federal government actually did release some of that information in its budget a couple of weeks ago, but we are asking for more of that commitment to a floor of 35%, which the premiers across the country have been calling for and health system leaders have also been calling for. So the fact that healthcare is a team sport, we need that money, we need that funding, and we need that to be part of the federal government's commitment moving forward.
Thank you, Dr. Kassam. The next question is, how can we get more doctors? Does the doctor shortage exist more in certain areas or specialties?
So the doctor shortage has been a chronic issue for years in this province and has most acutely affected rural, remote, and northern communities. In fact, in October, we were up in Sudbury releasing the northern part of our platform. And in the northern areas, there are acute shortages of close to 150 family doctors and 150 specialists just for the northern area alone. And this is exacerbated right across the province. So you can imagine that there are disparities based on geography, funding, and access, for example, to infrastructure. And so the answer to the question is, yes, we need to have more doctors here. And let's not forget, we're actually aging as a population, and there has been a commitment by all levels of government to increase immigration to grow our population to support the future of the country. And in so doing, we also have to recognize that we're going to need care providers to be able to take care of those folks who come here and who are also aging and using more healthcare resources. So we need to have both a domestic and an international health human resource strategy, in addition to shoring up what we have now immediately to ensure that the physicians and other health care providers in the system currently can continue doing their jobs effectively.
Thank you, Dr. Kassam. The next question is from Stella Duppy from Radio Canada. The Ontario government announced this morning it's investing $1 billion more over the next 3 years to further expand home care. Is it enough? Should it be priority?
Well, it should absolutely be a priority. And we're actually welcoming the news right now of that announcement. And of course, as we think about an aging and, as I said, a growing population, home care is going to be a key pillar in success for the transformation of our healthcare system. In fact, it's one of our 5 key pillars in our prescription for Ontario, our 5-point plan for better healthcare. In our plan, we've called for making home care, community care more robust, and that includes increased commitments like the ones that we are hearing about this morning from the provincial government. But it also includes things like tax credits to allow folks and families to remodel their homes in order to be able to serve their patients in a more appropriate context. I'll give you an example. My grandfather recently had this happen to him, where he's actually at home now being provided care by a care provider, and we had to make modifications to the home. If we had not been able to do that, he would actually be in another setting. And I think that this is part of the example of where not only diverse communities, but communities right across the country and frankly, the province want to be able to have their family members being taken care of at home in a more appropriate context. And frankly, it's better for the families, better for the patients, and it's less costly for the system. For example, just to give you a brief example of those numbers, it takes about $500 per day to treat a patient who are ALC or alternate level of care patients in the hospital, compared to $150 in long-term care and even less amount of money per day at home. And so when you think about the economic impact and the economic benefit, this goes a long way.
Thank you, Dr. Kassam. Why is clearing the backlog your top priority for the budget?
So 21 million healthcare services have gone delayed as a result of COVID-19 over the past 2 years. And that's someone's hip or knee replacement that's gone delayed. It's someone's cataract surgery that's gone delayed. It's someone's access to primary mental health care services that have gone delayed. It's an x-ray, it's an ultrasound, it's a colonoscopy or a mammogram that have gone delayed. And so what we see now is that smaller problems become bigger problems. And as these bigger problems now come back into the emergency room or come back into doctors' offices, they become harder to treat. And it's worse for the patient, and it's more costly for the system. And so this is the key priority that we have as a profession, as a system moving forward, so that we can ensure that patients get the care that they need at the time that they need it.
Thank you, Dr. Kassam. What are the top things that should be included in the provincial budget that could help our healthcare system deal with the problems created by the pandemic?
So we have 5 key areas that I think are relevant now and will be relevant moving forward in the future as we think about a transformation for our healthcare system, which is so desperately needed. So the first, we talked about the pandemic backlog of care. And of course, that includes funding that will help to get through the backlog, extending operating room and procedural time, including provider money, including provider resources, so that we can actually get through this backlog in a timely and more effective and efficient way. The second area, of course, is access to mental health and addiction services. And we know that the pandemic has actually touched a lot of us in our society as it pertains to mental health. And so we need to be able to improve and expand access. We know that this is going to be part of the sort of virtual care strategy for the future. This is an example of an innovative tool that we can use and leverage in order to get care to the folks that need it. But it also has to come, of course, with the appropriate broadband access in rural, northern, and remote communities. That's number 2. Number 3 is when we just talked about this, which is expanding home care and community-based care, palliative care, and other types of care in the community. We have to remember 75% of care that's delivered right across the province every single day in Ontario happens outside the 4 walls of a hospital. It happens in an urgent care clinic. It happens in a colonoscopy suite. It happens at a family doctor or a pediatrician's clinic. It happens at home. And so we have to be able to ensure that we can deliver care in more appropriate context. That's number 3. Number 4 is pandemic proofing the future, making sure that we are prepared for the next public health crisis. And so ensuring that public health is well funded, ensuring that we have a better governance model to react and respond to crises. That's going to be very important for the future. That's where we'd like to see some more investment. And then finally, what is the digital infrastructure for the future of healthcare in Ontario? When I think about digital infrastructure, I think about 3 key areas, and put virtual care aside for a moment. But the 3 key areas are digital integration, digital security, and digital privacy. And so all of those types of things as it pertains to data, that's going to be very important. And we need to see sort of investments at all levels of government to have a coordinated and robust strategy. So those would be the 5 key areas that we would like to see investment in moving forward.
Thank you, Dr. Kassam. A couple more questions for you, but I'd just like to take the time to remind media, if you do have any questions for Dr. Kassam, please put them into the Q&A chat box right now and we'll get to them. Our next question, Dr. Kassam, would more funding be enough to fix the backlog, or will the services be delayed for months or years anyway?
Well, funding helps. And it's a starting position, and most of what we want to be able to accomplish can't happen without the appropriate funding that comes along with it. But it's more than just funding. It's talking about system level factors. It's also about the health human resources. So you can throw money at a problem, but if you don't have the actual workers, the expertise, and the infrastructure to do the job, then it's really not going to move the needle very much. And so it's a combination of both. We need to have federal and provincial partners collaborate in a positive way for the future, but we also need a health human resource strategy. We know that COVID-19, for example, right now is having an impact on our hospital and our clinic ability to deliver care, partly because a lot of those healthcare providers, unfortunately, get COVID. They'll have to either isolate or be at home until they get better, and then come back into work. But that can take some time, and that can also curtail the ability for people to get care because the resources of care delivery have been impacted. And so this is a complex problem, and it will certainly take some time, including months, if not years, to improve. But we need to be able to stem the tide right now, and a commitment for funding will help to go a long way.
Thank you, Dr. Kassam. Our final question for you this morning: what about the missed diagnoses during the pandemic? Will we see wait times increase as the system deals with sicker patients?
Well, that's certainly one permutation of trying to get through care delivery in the context of a pandemic. And let me remind the folks on the call, this is happening right around the world. There has not been a jurisdiction that has been spared. When we think about great healthcare systems, we think about the National Health Services in the United Kingdom, they have a backlog problem. When we think about Western European countries like Germany and the Netherlands, they have a backlog problem. When we think about our system, we have a backlog problem. And this is going to have an impact on how people get care and the timely delivery of care. And just to reiterate, when we have smaller problems become larger problems, they become harder to treat, they have worse outcomes for patients, and they are more costly to deal with. And so this is a seminal moment right now for our recovery phase, which means that we need to be able to deliver care early, effectively, and have the system respond in a way that we can deal with upstream factors before they unfortunately take its toll on patients and the system.
Thank you very much, Dr. Kassam. We do have another question that just came in from Ray Chan. Foreign trained doctors complain for very time to get residency, even past the exam. Is there a solution to solve this shortage?
So I think the question, I'm having a bit of a challenging question in terms of understanding, but I do think the question that's being asked is how do we improve the ability for international medical graduates or foreign medical graduates to get through the system so that they can practice in our system. And so this is a very complex problem. There's no question we need to have more health human resources, especially as it pertains to physicians and other healthcare providers. I know that the provincial government has talked about sort of a quicker pipeline for credentialing for certain types of healthcare providers as well as other workers. I think this is a positive step forward, but really what this is going to require is to ensure that physicians who are coming here have a base or a fund of knowledge that is acceptable and appropriate so that they can deliver high quality care. Now, this might mean that they challenge the board examinations. This might mean that they go through a residency or a training program once again. And this also might mean, for example, to expand residency training programs to be able to accommodate this influx of new graduates. And let's remind ourselves that about a few weeks ago, the provincial government here in Ontario expanded both medical student spots as well as residency spots in order to try and tackle some of the both of the domestic and the international medical workforce issues. But we're going to continue to need that expansion. This is where the governments at all levels, including federal governments, have a role to play. We know that this was a significant issue on the campaign trail, both federally and provincially. So this is, once again, a problem that needs to be tackled. And it also needs to be tackled collaboratively between the licensing bodies and the regulatory colleges that govern the profession, both at a national and provincial level. So this requires some of that work in that space, both from a policy, regulation, and quality and safety issue. And this is something that the OMA is committed to helping be a leader in.
Thank you very much, Dr. Kassam. That brings us to the end of our Q&A session for today. Thank you to the media for participating and for all of your questions. With that, Dr. Kassam, I'm going to throw things back over to you for closing remarks.
Yeah, thank you so much, Ashley. And thank you everyone for attending today's briefing and for your thoughtful questions and your engagement. This is actually going to be my last media briefing as OMA president. My term comes to an end on May 5th next week when Dr. Rose Zacharias begins her one-year term. And so I'd like to personally thank those of you who've attended all or some of the 12 media briefings that I've chaired this year. And as you know, I've done almost 200 media interviews, and I appreciate the time and attention that you've given me to speak about issues of importance to Ontario's doctors, patients, and the healthcare system. And look, I'm cautiously optimistic that we're rounding the corner on the pandemic and that we'll be able to focus on the pressing issues in healthcare right across this province. And doctors have solutions for those issues, including wait times, including mental health challenges, care for seniors, and the doctor shortage that we just talked about. And I'm optimistic that by working with government and healthcare partners that we can and we will improve care for all of Ontario. So thank you again for attending today's briefing, and I hope our paths cross again.